Think of a world where you don't have to worry about your child becoming a statistic. Think of a world where you don't have to worry if your child will have a child before he or she graduates. Think of a world where your child is educated and knows how to prevent teen pregnancy and the spread of STDs and AIDS. Today, things can change. Today, we can make a difference. Hey, my name's Angela Waters, and today I'd like to share with you a program that educates youth so that we can lower the occurrences of teen pregnancy and STDs. By implementing a sex education course starting in the 6th grade and annually until graduation, we as a community may be able to prevent teen pregnancies. High rates of teen pregnancy still remains an issue here in the United States. According to the Center for Disease Control and Prevention, in 2014, almost 250,000 babies were born to women aged 15 to 19 years old. That totals 24.2 women per every 1,000 women in this age group. Declines in formal education and low rates of parents' direct communication with adolescents may leave them without an instruction at all. Between 2006 and 2013, there were significant declines in adolescents receiving formal instruction about birth control, saying no to sex, and information about STDs and HIV, according to the Journal of Adolescent Health, published in 2016. Today, 2 in 5 sexually active teen girls have an STD that can cause infertility and even death. Though rates of HIV are very low among adolescents, males make up more than 80% of HIV diagnoses among 13 to 19-year-olds, according to the U.S. Department of Health and Human Services. There are several reasons why a parent does not want the school system involved in teaching sex education. There are beliefs that it's not necessary for middle school students. However, there is relevant statistical data to support that this is in every way necessary. My mother did not want me to attend sex education courses in middle school because she felt it was her duty as a parent to teach me things herself. I was only afraid of pregnancy when I was an adolescent. I had no idea that sexually transmitted disease and infections could cause cancer or prevent me from not being able to have any children myself. Sure, your parents can teach you what they know, but do they know all the facts? Do you feel comfortable telling all of the facts? Through evidence-based research, there are learning plans that are equipped to handle these situations and educate appropriately in each age group. Another objection some parents have is maturity level. Students mature at different levels. Perhaps they feel that their child could be blindsided from this information or even traumatized. While maturity level is a very important topic to consider, it is still important to have the knowledge since that child will be side to side with students of different maturity levels. The information received from other students could be far from the truth, causing more confusion for that child. By providing facts from an experienced licensed provider in the learning atmosphere, our children will be able to distinguish the difference from the facts from the myths. Some people believe that education on abstinence only until marriage is the appropriate education course for children. However, in the article, The State of the Sex Education in the United States, research has documented that a lack of efficiency in abstinence only until after marriage education. Abstinence only until after marriage education does not delay sexual initiation. Abstinence only education does not reduce sexual risky behaviors. There's also evidence that supports that abstinence only until after marriage does not improve reproductive health outcomes. By supplying facts to our youth about teen pregnancy, HIV, and AIDS, they will have the facts before getting in that situation where they had no idea of the risk. Safe practices will be taught, including condom facts, abstinence, and way to say no, birth control information, and local resources that parents and teenagers can utilize. In the journal Advocates for Youth, behavioral outcomes and result to sex education have included delay in the initiation of sex, reducing the frequency of sex, the number of new partners, and the incidence of unprotected sex. Behavioral outcomes have also included an increase in the use of condoms and contraception among sexually active participants. Education is power, and our children should be armed with the knowledge of prevention. Think about the number of children each year that have to spend the rest of their lives with these diseases and infections in early pregnancy. Think of your child having to live without ever being able to have a child of their own due to an infection that could have been prevented with education, screening tools, and resources to help them. In the article, Consequences of Sex Education on Teen and Young Adults, students found that sex education that covered both abstinence and birth control was associated with better outcomes for young people's sexual health than no instruction at all. Perhaps the most significant discovery was that education did not lead to promiscuity. Rather, sexuality education leads to lower levels of sexual risk-taking. Today, I want you to educate yourself on the information I provided, and together we will arm our children with the knowledge of prevention. Wellness service information from the Department of Health in each county is available. Please think about all the topics we have discussed today and tell me what you think. What type of future do you want for your children and our children in this community?